This story does not involve a serial killer. It does not involve a ghost or a conspiracy theory or something that can be explained away as fiction. This story involves the United States government and 400 men who trusted it. What you are about to hear is documented in government archives, congressional testimonies, federal court records, and the personal accounts of the men who survived it. Every detail is real. Every name is real. Every death is real. The United States Public Health Service ran a medical study in Macon County, Alabama for 40 years, from 1932 to 1972. They recruited nearly 400 black men who had syphilis. They told them they were being treated for bad blood. They were not treated. They were observed. They were watched as the disease progressed through their bodies and destroyed them from the inside. And when a cure was discovered, a simple, effective, cheap cure, the government chose not to give it to them for 25 more years. This is the Abyss Narrator, and this is the Tuskegee Experiment. To understand what happened in Tuskegee, Alabama, you have to understand what Macon County was in 1932. It was one of the poorest counties in the United States. The Great Depression had arrived with particular cruelty in the rural South, where sharecropping had already kept black families in a cycle of poverty that had changed very little since the end of Reconstruction. The men who worked the land did not own it. The men who built the towns did not govern them. Medical care was not something most black families in Macon County had regular access to, not because they didn't want it, but because the segregated healthcare system of the American South made it effectively unavailable. When a doctor arrived and offered free examinations, most men came. When the same doctor offered free meals on examination days, more men came. When the program offered burial insurance, guaranteed coverage for their families, the men who came stayed. This is how the study recruited, with the things it knew these men needed most, and the men who had no reason to distrust the government doctors who arrived with medicine bags and friendly faces responded with something that would later be described by one historian as an almost heartbreaking degree of trust. The study was called the Tuskegee Study of Untreated Syphilis in the Negro Male. Its official sponsor was the United States Public Health Service. Its institutional partner was the Tuskegee Institute, one of the most respected black academic institutions in America, a fact that would later complicate the story in ways that are difficult to fully reckon with. The researchers enrolled 399 black men who had latent syphilis, meaning the disease was present but not yet producing its most severe symptoms. They also enrolled 201 men without syphilis as a control group. The study was designed to track the natural progression of untreated syphilis over time, comparing it to outcomes in the control group. The men were told they had bad blood, a local expression used to describe a range of ailments, from fatigue to anemia to general poor health. They were told the doctors were going to treat them for it. They were never told they had syphilis. They were never told what the study was really for, and they were never given treatment. To understand what the government did to these men, you need to understand what syphilis does to a human body when left untreated. In its early stages, syphilis causes sores and rashes, manageable, treatable. In this stage, the disease looks like many other things, which is partly why it was so common in the rural South of the 1930s, where medical diagnosis was inconsistent and treatment was inaccessible. But left untreated over years and decades, syphilis becomes something else entirely. In its tertiary stage, the bacteria that causes syphilis attacks the body's major organ systems. It moves into the cardiovascular system, weakening the walls of the aorta and causing aneurysms that rupture without warning. It moves into the central nervous system, causing a condition called neurosyphilis, a slow, progressive destruction of the brain and spinal cord that produces personality changes, loss of coordination, blindness, deafness, dementia, and eventually death. The men in the Tuskegee study were enrolled in 1932. Some of them were already showing early tertiary symptoms. The doctors knew this. They documented it in their research notes. They described in clinical language the progression they were observing, the cardiovascular changes, the neurological deterioration, the suffering. They wrote it down. They filed it. They continued the study. In 1943, 11 years into the Tuskegee study, the United States Public Health Service, the same agency running the study, adopted penicillin as the standard treatment for syphilis. Penicillin worked. It worked quickly, completely, and with minimal side effects. A course of penicillin in the early stages of syphilis could cure the disease entirely. Even in later stages, it could halt the progression and prevent the worst outcomes. The men in the Tuskegee study were not given penicillin. The researchers made a deliberate decision to exclude them from treatment. Their reasoning, as documented in internal memos, was that treating the men would compromise the integrity of the study. The whole point, the only point, was to observe what happened to untreated syphilis over time. Giving the men penicillin would end the study. So the study continued. In 1947, penicillin became widely available across the United States. It became the first-line treatment for syphilis in every state. Public health campaigns promoted it, clinics distributed it. The syphilis epidemic in America began to decline. The men in Tuskegee were still not treated. There is a detail from this period that is almost impossible to process when you first encounter it. During World War II, some of the men in the Tuskegee study were called up by their local draft boards. When the draft board's medical examinations identified these men as having syphilis, the boards tried to treat them. Under wartime medical protocols, syphilis was considered a disqualifying condition that required treatment before induction. The researchers contacted the draft boards. They asked the boards not to treat the men. They asked that the men be identified to them so they could be monitored and returned to the study. The draft boards complied. The men were sent back to Macon County, back to the study, back to the doctors who examined them and gave them vitamins and aspirin and free meals and told them they were being cared for. There is one figure in the Tuskegee story who resists simple explanation, and her name is Eunice Rivers. Eunice Rivers was a black nurse from Alabama, trained at the Tuskegee Institute, who served as the primary liaison between the researchers and the men in the study from its beginning in 1932 until its end in 1972. For 40 years, she was the constant human face of the program, the person the men saw at every appointment, the person they trusted, the person who drove them to examinations, who sat with them when they were ill, who attended their funerals and collected their burial records. The men loved her. They called the program Miss Rivers Lodge. They trusted her completely. She was, for many of them, the most reliable and caring presence they had encountered from any institution. She believed, or she told herself she believed, that the men were receiving care they would not otherwise have had access to. She told herself that the aspirin and the vitamins and the regular examinations were more than these men would have gotten without the study. She told herself that the researchers were acting in good faith, that the study had value, that the results would benefit medicine and ultimately benefit communities like the one she had grown up in. She continued for 40 years. The question of Eunice Rivers, whether she was a victim of the same system that victimized the men, or whether she was a participant in their harm, or whether the answer is something more complicated than either of those options, is one that historians and ethicists have argued about for decades without resolution. What is not arguable is that she knew the men were not being treated, and she stayed. The Tuskegee study did not run for 40 years without anyone inside the system raising objections. There were people who saw what was happening and said something. They were ignored. In 1966, a public health worker named Peter Buxton reviewed the Tuskegee files and was disturbed by what he found. He wrote a formal memo to his superiors at the Public Health Service. He argued that the study was ethically indefensible, that deceiving men about their diagnosis, withholding treatment, and continuing to observe their deterioration violated basic principles of medical ethics. The response he received was dismissive. A review panel was convened. The panel concluded that the study should continue. Its official recommendation was that it be maintained until all participants had died and autopsies could be performed. Until all participants had died. Buxton kept his files. He waited. He raised the issue again in 1968. Again, he was ignored. For 6 years, he carried the knowledge of what was happening in Macon County and could find no one within the system willing to stop it. In 1972, he took his files to a journalist. Jean Heller was a reporter for the Associated Press. In the summer of 1972, Peter Buxton brought her the documentation he had gathered over 6 years of failed internal complaints. She read it. She verified it. She spent weeks confirming details from multiple sources within the Public Health Service. On July 25, 1972, the Associated Press ran her story on the front page. The headline read, "Syphilis patients died untreated. The country stopped." Senator Edward Kennedy opened congressional hearings within weeks. Survivors testified. Researchers testified. Department of Health officials testified. The documentation that Buxton had preserved, The internal memos, the research notes, the deliberate decisions to withhold penicillin, the request to draft boards not to treat the men, was entered into the public record. The study was terminated on November 16, 1972, 40 years, 1 month, and 28 days after it had begun. What had happened to the men in that time? 28 men had died directly of syphilis. 100 had died of complications related to the disease. 40 wives had been infected. 19 children had been born with congenital syphilis, a disease they had contracted before they were born, from fathers who had been enrolled in a government health study. The survivors received a class action settlement of $10 million in 1974. They received lifetime medical care. They received eventually something else. On May 16, 1997, President Bill Clinton stood in the East Room of the White House before a group of the surviving men, by then elderly, some in wheelchairs, some accompanied by family members of those who had already died, and said the following words: "What was done cannot be undone. But we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry." The last survivor of the Tuskegee study, a man named Fred Simmons, died in January of 2004. He was 110 years old. The end of the Tuskegee study was not the end of its effects. Medical researchers and public health officials who have studied Black American communities in the decades since 1972 have documented something that became known as the Tuskegee effect, a measurable, persistent, statistically significant reduction in trust in the American medical system among Black Americans that traces directly to knowledge of the study. When researchers surveyed Black Americans about their willingness to participate in clinical trials, to seek medical care, to accept vaccines, to trust government health recommendations, the shadow of Tuskegee appeared consistently in the data. Men who had heard about the study were less likely to see doctors. Communities where awareness of the study was highest showed lower rates of medical engagement across multiple metrics. Economists who studied the data estimated that the reduction in medical engagement may have contributed to as many as 35% of the gap in life expectancy between Black and white men in the affected counties. The study ended in 1972. Its consequences were still killing people decades later. And in 2020, when a novel coronavirus swept the world and governments moved with unprecedented speed to develop and distribute vaccines, something happened that public health officials had feared for years. Vaccine hesitancy in Black American communities was significantly higher than in other demographic groups. Surveys showed that distrust of government health institutions was a primary driver. And when researchers asked respondents to explain their hesitancy, one reference came up again and again: Tuskegee. A study that ended in 1972 was influencing decisions about a vaccine in 2021. The government had given those men bad blood, and the knowledge of what it had done continued to spread through communities like a disease of its own, one with no cure, no treatment, and no end in sight. What do we take from this? The Tuskegee experiment was not the work of rogue scientists operating outside the system. It was not a secret program that a small group of bad actors carried out without institutional knowledge. It was conducted by the United States Public Health Service. It was reviewed and reauthorized multiple times by panels of medical professionals. It ran through the administrations of 8 American presidents. It continued for 25 years after penicillin made a cure available. It was not a mistake. It was a choice, made again and again and again, over 40 years, by people who had the information they needed to stop and decided not to. The men of Macon County trusted the government. They showed up for their appointments. They took the pills they were given. They believed the doctors who told them they were being cared for. They did everything right, and the institution they trusted used that trust to watch them die. The records are preserved. The testimonies exist. The names of every man enrolled in the study, every man who was deceived, every man who was denied treatment, every man who died, are documented. They are not forgotten. This is The Abyss Narrator. If this story disturbed you, good. It should. Subscribe so the algorithm doesn't bury the next one. Send a star on Facebook. It is the only way to tell me you want to keep hearing the stories that don't make it into textbooks. Find us on YouTube, Instagram, TikTok, and wherever you go when you need to understand what actually happened. We will see you in the next one.